Thank you, Mr. Chairman, and thanks for fitting me in. I want to talk a little about home and community-based services and get the reaction from this great panel of witnesses. Uh, in Ohio, about 40% of our COVID deaths were in nursing homes, and that's not atypical, unfortunately, around the country. We tend to have a little higher percentage of people in nursing homes than other states, but 40%. This makes it really the focus and really the worst part of our crisis. 7,000 nursing home residents in Ohio lost their lives over the past year. It has improved recently dramatically because of the vaccinations, and I'm excited about that. But in the meantime, it's been a huge problem. Long-term care, of course, is really important to ensuring seniors and people with disabilities can live meaningful lives. And while nursing homes are essential to our country's long-term care system, they're not the only ones that offer this care. For years, I've championed this push toward home and community-based services, or HCBS, where we can offer long-term care in residential settings that are more personalized and allow beneficiaries to live in their own homes, near to their family and their friends and their familiar surroundings. This is what we know about HCBS care. It costs less than nursing home care. It produces similar or better outcomes, and people are happier in it. Furthermore, Ohio data has shown that only 0.3% of all beneficiaries with severe disabilities receiving HCBS died of COVID this past year, or about 120 deaths. So it was more successful in avoiding the fatalities with regard to COVID. Because it works, last year we passed two major efforts that the chair, ranking members, and others have supported. I appreciate that. We passed Ensuring Access to ESPs Act, which allows people on Medicaid who use direct support professionals for HCBS care to have them assist with their hospital care to help improve outcomes and get them back home quicker. That was really important, particularly for the disabilities community, and Medicaid now covers that. We also passed the Empower Care Act, which authorizes the Money Follows the Person program for 3 additional years. I would like to have gone further on that. And again, many colleagues on the other side of the aisle have helped on this. But it helps transition people from nursing homes to HCBS care. My question to the panel is this: when the pandemic was beginning, what could we have done to better utilize HCBS services and potentially prevent some of these deaths? And second, what policy changes should we now consider in order to further promote such services? And open to the panel.
I'll start. I think it's, I thank you for your efforts to expand home and community-based care. I dream of a system where the funding mechanisms are smooth between nursing homes and home and community-based care, and people and policymakers can decide how to target that care appropriately, and people can get care where they would like. I only caution that it's not a panacea, that we probably will always need nursing homes. And there are some cases in which home and community-based care can lead to worse outcomes. I think we have to be very careful about targeting. But I think that expansion of home and community-based care in a pandemic or beyond is critical.
Thank you. Mr. Dickin, have you looked into this for GAO?
Yes, thank you. And it's certainly a really important question, and certainly agree that's important, especially in a pandemic, but at any time, to make sure that people are getting the appropriate long-term care in the appropriate setting. In this area, there is much less federal information and data on what's occurring in home and community-based settings or assisted living than in nursing homes. I know that today's hearing is focused on some of the limitations and what is known within nursing homes. You were able to indicate some Ohio-specific information, and there is information at the state level, but many of the same vulnerabilities exist for a population that is at risk, that needs direct support. And we've heard similar types of challenges of things like having adequate protective equipment, staffing challenges. So similar types of challenges, maybe less of a congregate setting in some settings. And so, but also much less information at the federal level on what's occurring in settings outside of nursing homes.
So more data is needed, and if we had that data, we would have a better understanding of what the different outcomes are.
Certainly be helpful, yes.
Yeah. Ms. Ramos or Dr. Gifford, any thoughts?
Go ahead, Ms. Ramos.
I think that in the nursing homes, we need oversight, and Congress are the only ones that can have that law passed. Right now, we fight in a state level, but it's not just our state problems that we have these issues in the nursing homes. It's across the country, and our union is fighting really hard for us to pass a bill that everyone in the states and in this country will have a law that will support the staff and the
Thank you.
patients for quality care.
Thank you.
Okay.
Thank you. Thank you, Mr. Chairman. Dr. Gifford, if you have additional thoughts, I'd love to hear them, maybe with a written response. Thank you very much. Thank you, Mr. Chairman.